Hello, welcome to Peak. My name is Fe Anam Avis. I am the founder and the director of Peak, Parents of Estranged Adult Kids. I have a guest with me today. It's Dr. Stephen Birchard. Steve's been a veterinarian surgeon for about 46 years. Got his doctorate of veterinary medicine from the University of Missouri and did his surgical residency at Purdue. Steve really has an international reputation as a veterinarian surgeon. He's lectured in, besides the United States, in 13 other countries. He has edited and co-edited texts that are used to train veterinarian surgeons today. But more recently, he's written this wonderful book, Their Tails Keep Wagging. And we want to talk a little bit about that with some other things. Steve, welcome. Good to have you with us.
Thank you. It's my pleasure.
We'll get back to the book in a moment, but let's go back to some beginnings. What motivated you to become a veterinarian in the first place?
Yeah, that's a good question. I mean, the obvious answer is that I've always loved animals and been very comfortable around animals. And I think that as time went on, though, I found that I think that was just the tip of the iceberg for me because I just love nature in general. But I guess my way of really sort of connecting with nature is through animals. And even as a young child, I was just drawn to animals. A quick story, my family didn't have a pet for many years until I was probably a teenager. So what I would do so that I could have some time with dogs and cats is I would go to other people's houses who had dogs and cats so that I could spend time with them. So it's almost like, you know, we talk about with the kids having a play date. Well, I would make play dates with people's pets so that I could just spend time with them. But I just always enjoyed time spending with animals, and I guess the other thing is that they seemed comfortable with me, which really told me something about the connection. I can remember many times going over to these people's houses, and they would say, you know, he really our dog, he really doesn't like strangers, or he doesn't like children, but you seem to be different in this respect. He likes you for some reason. So every time I heard that, I thought, you know, I think maybe I should make this my career. So
in the different stages of our lives, hearing that we're important, even to an animal, can be really, really important.
Absolutely.
Development and health. And we'll talk some more about that a little bit later in our conversation. So you became your specialty is really animal surgery. What do you find most rewarding about being a surgeon?
Yeah, and that wasn't my plan originally. When I went through vet school, my plan was to once I graduated to go back to my where I was from in the Philadelphia area, New Jersey, and just be a practitioner, a general practitioner, doing all sorts of healthcare issues, and I noticed that when an animal needed some kind of an operation, that I liked that part of practice, and a very good friend of mine and colleague, and still a close friend of mine, Dr. Ron Bright. Actually, when I was a student, he encouraged me to pursue that, or at least to consider it. And then he's the one that even took it a step farther. When I was in practice, he called me out of the blue and said, hey, we have an opening in our surgical residency program here at Purdue. I think you should apply. Well, you know, I had so much respect for him. I thought, wow, this sounds like a fantastic opportunity. I think that the thing that draws me to it, and I've seen even physician surgeons say the same thing, is the chance to make an immediate impact on a sick animal or a sick patient, for that matter. because what you do is, it's very tangible.
Mm-hmm.
It involves your hands. I like doing things with my hands anyway. I think it's just that the chance to have that immediate, it's almost like immediate gratification kind of thing. Now, the flip side of that coin is that if surgery doesn't go well, or if it turns out that, there's some unexpected complications, then, it's a two-edged sword. But just that chance to really have a positive impact, I think is the thing that's so gratifying and so rewarding, and draws people to it.
Yeah, yeah. Never thought about that. Yeah, the kind of immediate benefit that you're able to give to an animal through surgery that,
right,
with something like medication, takes longer, to see the results of that, or other kinds of changes. Well, you've got the book, Their Tails Kept Wagging. First, congratulations on having this published. Tell us a little bit about what motivated you to write it in the first place.
Yeah, and I think it's important that I also congratulate you for being my co-author on the book.
Thank you.
Because your help was invaluable, and really the birth of this book, if you remember, was actually seems like a long time ago now, doesn't it? Several years ago.
Yes.
We were talking about things and kind of brainstorming the idea, and I think it was actually your idea to say, hey, I hear you talk about healing as a part of the process that an animal goes through of either being sick or injured. And he said, and you said that you've always been fascinated with that. And so you said, why don't you write a book about it? And I immediately thought, yeah, it seems like if you're gonna, it's a lot of work, but if you're gonna do the work, it should be something you're passionate about. That would make it a lot easier to do. So we started out, in fact, I think you probably remember our initial idea on a title was Wisdom from Wounds. And that's what we started with. But then it's funny, as I was writing the book, it almost took on a life of its own, because I decided to do it as a collection of stories of different animals that I had treated over the years, all of whom had really significant critical illness, either through injury or through just really severe infection or something like that. And, for example, one of the chapters is about a dog that got shot with an arrow, and the arrow went completely through the dog's heart. And yet the dog walked in wagging its tail. So it was true to the title of the book. It's a remarkable story.
Oh, it's such a great story.
Yeah, I mean, and the stories, the thing that I really enjoyed about it were the stories were about the animals and their medical issues, but then there were so many other things that became important to their stories, and I actually sort of discovered it as I was writing them. And the main one would be not just the trying to give them state-of-the-art care while they were in the hospital, but then talking about the caregivers, and how these animals affected them. So it started out as really kind of a medical book written for non-medical people, but then it became more about our relationships, our relationship with the animal, our relationship with each other, and just how these animals affected all of us as humans. And that part of the story took on a very, very important role in the stories.
I love that. Now that you mention that, I remember back, I think, to that conversation, because I think you made the comment to me, because I've always been interested in spirituality, and I think you said to me, you know what I think the greatest miracle is? Wound healing. I'll never forget that. Wound healing. And I thought about that, and that is an amazing process. And so you've kind of taken that miraculous nature of how tissues heal, and then expanded it to kind of the other relationships that are kind of important around the healing process, which is just beautiful.
Right.
The subtitle is "Pets Show Us How Hope, Forgiveness, and Love Prevail." What do you think some of the lessons are from the book that human beings could benefit from?
Yeah, I think there's a number of
creatures in our lives.
Yeah. I think there's a number of them if we're willing to sort of open our minds to what these sick animals are going through, and honestly, a lot of them, the illness or the injury was really life-threatening, and there were periods where I wasn't really sure the animal was going to make it, or I wasn't sure that the owners were going to continue to pursue treatment or elect to do euthanasia, humane euthanasia. So the animals, now we can argue that whether or not they actually have the kind of intelligence that's required to do, for example, to forgive. But in my mind, even the animals where the injury was due to an accident caused by their owners, which of course is just a horrible situation for these people because they love these animals. But for example, one of the chapters is about a dog that in the middle of the chaos of moving from one house to a new house, the owners, their golden retriever, Charlie, he kept getting out of the house, and they were worried that he was going to run away. And so they hooked a leash up to his collar, and they couldn't find a good place to tie the leash. So they tied it to the rear bumper of the trailer, their U-Haul trailer. And then again, in all the chaos, they forgot that they had tied him up there, and they drove away. So he was basically dragged by this trailer for a mile, and it had caused really pretty horrific injuries. The long story short is that he even though it was a very long, drawn out, intensive care process, he finally did okay. But those poor owners, the guilt that they had to deal with was just overwhelming. But the dog never did anything to make it seem like he was mad at them, or that he blamed them, or that he had anything, or even decreased his affection for them.
Yeah.
So so you could say, well, he just doesn't have the ability to make that association between what they did and his injuries. But just looking at that and reflecting back on it, I'm calling it forgiveness. That he showed this incredible forgiveness, and that at least was something the owners could hold on to through the very dark period where we weren't sure if he was going to make it or not.
Yeah, we could learn to do that with one another.
Yes, exactly.
It would certainly be a different world.
The hope part of it, it starts out just in the very first chapter, the dog that had a really severe stomach disorder that required multiple surgeries. He again also became so close to dying, and at points in his care in the hospital, he couldn't even get up. He was so weak and so depressed. He couldn't move any part of his body except his tail. He was still able to move his tail, and through all of the critical and intense part of his illness, when I would walk in to get near him so I could examine him, that tail would just thump, thump. And to me, that was a signal. That was a signal of hope. That was him telling me, I can't move, but I'm telling you that I know you're here, and I'm happy you're here, and I'm still alive. And let's not give up. Let's keep this thing going.
That's a great story. And I think metaphorically, when we're with friends who are going through a hard time, a question would be, is your tail still wagging still wagging today.
Yes, exactly.
I love it. I love it. So um, we're seeing a lot more, I think, people with pets today. We live in an apartment building. Sometimes I think there are more pets than there are people.
Mm-hmm.
So it seems to be a trend. Why do you think that is?
Yeah, I think there's a couple of things. There's probably a lot of factors. I think that if you look at the short-term simple answer, you could say that COVID certainly facilitated the pet ownership because so many people were stuck at home during the lockdown. And that did create a huge uptick in pet ownership, although it was already big. I mean, the last thing I read was that over 60% of American households have some kind of a pet. So it went up even from there. People that work in humane societies were just amazed how many people, the influx of people wanting to adopt an animal. But I also think there's a more long-term effect of that, and I don't know that I have any figures to back this up, but we seem to be more homebound people now than we have been in the past. I think you just look at the changes in the houses that have occurred over years. We have the internet. We don't have to go outside of our house very often anymore. And it seems like we don't really want to. We have these huge TVs that are sort of like our own little movie theater, and all these internet streaming channels where we can get movies. We can order food and just have it delivered from almost any place. So I think we're more homebound folks, and because of that, we like having these animals around. I mean, man has a history of going back thousands and thousands of years, wanting a companionship with animals, hence the domestication of species. But I think, and the other thing is that there's almost an animal for every family, if you think about it. Like you're in an apartment, well, there's all sizes of dogs, big dogs, little dogs. There's dogs with different temperaments. There's some dogs that are ideal for an apartment. And then there's cats. Cats, you don't have to have much of a property to have a cat. Cats do very well with just an apartment type of environment. So there's a lot of opportunity there.
Yeah. So in Peak, we work with parents who have lost the relationship with their adult children. And one of the things that we have discovered in this work is that the impact of that loss really falls into the category of trauma. And estranged parents really exhibit many of the same symptoms of PTSD, like folks that return from a war zone. And one dimension of that is mental, emotional. We see a lot of depression, anxiety, feelings of guilt and shame, a lot of loneliness. Is there any research that would suggest that owning a pet can help with these, these kinds of symptoms? I mean, we all know about going to a doctor and being put on antidepressants and that kind of thing, which certainly has its place. Is there any evidence in research that having a pet can be a kind of medicine of its own?
Yeah, absolutely. Yeah, there's many studies looking at both the physical benefits, but also the psychological and mental benefits. Pets, if you live by yourself, a pet helps with the feeling of loneliness. They're a companion, many times a very dependable companion. They don't usually get mad at you. you can almost say anything to them. There's this feeling of being of unconditional love from pets. They, no matter what your day is like, they are going to come up to you and want to be petted and want to sit on your lap or want to be taken for a walk. So there's that companionship. People feel less lonely. There's actually lots of science looking at this. There's a study looking at where people are doing group therapy for some disorder or some really traumatic event in their life, and maybe, like I say, post-traumatic stress disorder. If the organizer of the small group session brings a dog with them, they notice there's a completely different vibe in the room. People are more willing to open up. They feel more relaxed. They pet the dog. It helps them to take it easy. There's one study where a person with mental illness was being treated, and they monitored some of their vital signs. So when a very friendly adult human would come in with the therapist, they measured their vital signs and found that their blood pressure just stayed the same, didn't go up, didn't go down. But if they brought a dog in, a friendly dog that sought out some affection and gave affection, their blood pressure went down. So they found that, at least from a physical standpoint, from a cardiovascular standpoint, there was more benefit by bringing a dog than by bringing a friendly human being into the room. People that are going through a divorce are able to deal with the consequences better when they have a pet. There's study after study looking at that.
And does that, you mentioned hypertension. So in addition to kind of reduction of anxiety and elevation of mood and that kind of thing,
right?
We're often dealing with physical symptoms too. So the strange parents often are, have increased GI disturbances, headaches, musculoskeletal kinds of issues, cardiac issues, arrhythmias, as well as the hypertension you're talking about. Do you think that the benefits of pet ownership extend to those kind? It sounds like with hypertension it does. Do you think it extends to an alleviation of some of these physical symptoms as well?
Yes, absolutely. And I think it's something that we've known for a long time, but really didn't have any good clinical studies to back it up. Well, now there's a bunch of them. And one that I really liked that came out about 3 years ago, and it was endorsed by the American Heart Association, was a meta-analysis study where they take the data from multiple studies, multiple experiments with people and animals and put it together. And they combined this one paper. They looked at over 3 million people in this paper.
Wow. And
found that patients with pets live longer and have far fewer cardiovascular pathology than people that don't have pets. There was like a 25% difference. The statistics were very clear. And especially even more so in people that have had a cardiovascular event of some sort, a heart attack or very high blood pressure or even stroke, that having a pet gave them a 30% chance of living longer, statistically longer life with pets than those that did not have pets. So very, very compelling study that using tremendous amount of data. But there's so many others as well. There's one of the ones I like is, like you say, besides the blood pressure, heart rate, even their blood work is better. Your blood work is better if you have a pet. Your lipid profile improves with a pet. So you say, well, why is that? Well, for one thing, it's not just this psychological benefit, but pets tend to make us more active.
Wow.
Because they love going out for a walk, or even go out in the backyard and fetch a ball, or just play. So we're more active when we have a pet, which is obviously better for our health. Mm. And there's even benefits in the immune system. There's a study I looked at about a year ago. They took a group of college students who were willing to go through this experiment. Half of the students were given a stuffed animal, and they were given a defined period of time to pet the stuffed animal. And the animal, the stuffed animal, looked similar to a live dog. The other half were actually petting a live dog. And they measured their antibodies. And the students that petted live animals had a higher level of immunoprotective antibodies in their blood after petting a dog than those that petted a stuffed animal.
Wow.
So, yeah, there's lots and lots of very significant evidence showing both physical and mental benefits.
Wow, that's wonderful. And no side effects. That's great. That's terrific.
Well, yeah, I mean, it's not all peaches and cream. I mean, they
have needs, but yeah.
Yes, they do have needs, and that's another part of the system, is that they benefit from this contact with us. That's a whole nother branch of studies where animals that have physical contact with a human being get ill less frequently and recover from illness quicker. Mm. And so that's one of the things I try to bring out in the book, is that the caregivers, besides just giving them their pills and their shots and taking their samples, I always try to get my students and technicians spend time with you, and I did it myself. Touch them. You've got to touch these animals. You'll feel better, and you'll make a big difference in how they feel. And now there's even scientific studies to show that.
Wow, that's really terrific. So thinking about estranged parents, by definition, most of them are over 55 years of age. So they're moving into an older adult category. Of course, some are much older. What kinds of considerations should an older adult, an estranged parent, for example, keep in mind in making a decision about getting a pet?
I think one thing that owners need to think about before getting a pet is what is my physical capabilities? What are my physical capabilities? If it's a dog that likes a lot of exercise, they like to retrieve, or they just like to play, or they like to be taken out for a walk, and will I be able to do that with them? Mm-hmm. And the size of dog, I think, would be a consideration. Mm-hmm. In other words, if you don't feel confident in being able to control a big dog, then it's probably better to look at smaller dogs, or maybe even cats. The nice thing about cats is, I mean, some people actually do take their cats out for a walk, but it's not common, you know. So a cat requires less physical effort than a dog. I think in general, older folks, you probably want to stay away from breeds of dogs that really need a lot of intense physical activity. An example would be a Siberian Husky. They're very high-strung dogs to begin with. And they're bred, if you go back to their history, they're bred to pull sleds through the snow. And they love doing that.
They love pulling you.
Yeah, right. Yes, exactly. So if you're 90 years old, I probably would say you might want to steer away from. And maybe even a lot of the working breeds of dogs, German Shepherd, Husky, maybe the Retriever, although Retrievers, I think it's not as big an issue. But I think for older folks, I'd probably look at smaller animals in case you have to lift them up for some reason. The other thing I generally say is if we, rather than looking at specific breeds, I usually tell people, you know, just start with going to your local shelter, humane society, or look at rescue groups so that you can not just adopt an animal, but really save its life.
Yeah. Yeah.
Because there's so many out there that are looking for a good home.
Yeah.
Yeah. But yeah, I think mainly it would be just some of the physical aspects, trying to get a dog that doesn't require a tremendous amount of physical exercise, and then just the size.
What, Steve? What would you say are options for people that could really benefit from contact with animals, but for whom ownership of a pet probably isn't realistic? Are there any things that they might think about doing that would be good for them?
Yeah. Well, one thing would be, if you go back to my original story of me as a kid doing play dates with other people's pets.
That's good.
And, I mean, that, you know, that would be an option.
Yeah.
And, you know, it's like, say, older folks who really just can't take care of an animal, those folks, or maybe even friends, could bring an animal to them to spend time in their place. There's this whole area of dog training called therapy dogs that are taken to nursing homes, hospitals. And again, there's so much evidence now that has a really beneficial effect on these people, even just spending a few hours with a dog in the nursing home, for example. And I think the other thing, and maybe part of it might be the allergy situation. You know, a lot of people have a lot of intense allergies to either dogs or cats. But, you know, the other thing they could do is maybe do some volunteer work at a humane society where they would have some contact with the animals. You know, their humane societies are constantly looking for people to just help them. Take the animals out for a walk, or spend some time grooming them, brush them out, or things like that. So I think that would be something to consider as well.
Well, those are great ideas I've never thought of. So I guess to end, again, congratulations on the book. And how do people get a hold of it?
Well, right now we just released it a few weeks ago, so I don't think many of the brick and mortar bookstores have it yet, but it is available online, Amazon.com, Barnes and Noble. So any of the major online book dealers have it now. So,
and it's in Kindle as well as paperback, right?
Paperback, yes, that's correct. Yeah,
good. Well, again, congratulations, and wow, this is such a great a great resource, and I think for people who are suffering in a variety of ways, including estranged parents, I think this is really, you know, we talk about there's no magic pill, there's no silver bullet, you know, for the kinds of things that we have to do to heal as human beings.
Right.
And this is certainly kind of one real possibility of a total package of how we heal.
Right.
That sounds wonderful. Steve, thank you so much.
You're welcome. Thank you for having me.